Hello and welcome to Pomona. Pomona is a city in Los Angeles County, California. Pomona is located in the Pomona Valley between the Inland Empire and the San Gabriel Valley, just 34 miles east of Los Angeles. Pomona is home to a population of 152,361 people as of 2018. This is a 2.2% increase since 2010. This map shows where most of the population lives, in the dark blue areas. On our next slide, we have the median age, which is 30, with 25% being under 18 and 9.4% being 65 and over. The darker blue areas on this map represent where people closer to 59 live, while the light blue shows where the younger population age 19 live. Next, we have gender. Pomona has a population of 50.3% female, so there is a pretty even ratio of female to male. The next map shows where the most females live in the dark blue. And then on the opposite spectrum, this map shows where the males live, which is pretty similar to the females map. Our next demographic is ethnicity. Pomona's majority of population has 70.6% Latino or Hispanics. As you can see from this graph, there are 11% white alone, which is not Latino or Hispanic, 9.7% Asian alone, and 6.3% Black or African American. There are also 4.1% two or more races and 1.9% American Indian and Alaska Native alone. This next graph shows the area in which they live. The dark blue shows Hispanic or Latino. Notice the darkest of the blue has almost 7,000 people here. The next map shows the white population, in which we see no dark blue areas at all. Finally, this next map shows Black or African Americans, in which the darkest blue means there are 800 people of this group. The next demographic we will discuss is income. In Pomona, 20.7% of the population live in poverty, which accounts for about 30,000 people when put into numbers. The median household income is $53,281 in 2017. As you can see from this map, the light blue is the lowest income, while the dark blue is the largest income of $81,000 and above. The dark blue is close to Diamond Bar, which is a wealthy area. We also see a medium blue color near Claremont, also a wealthy area, with the poorest areas in the center. The next graph similarly shows the household income from $29,000 in the light blue to $135,000 in the dark blue, which we see none. Again, we see the highest income in the areas closest to Diamond Bar and Claremont, and the poorest areas in the center. The next demographic we will discuss is education levels. 68.5% of the population have a high school diploma and above, while only 17.7% have bachelor's degree and above. This map shows the population who has a high school diploma and above, in which the darkest blue we see represents 100%. As we move to a bachelor's degree and higher, we notice the same trend and nearly identical color scheme. Because many people do not have degrees, we wanted to look at the high school dropouts, in which you can see a majority of the color is in the center of Pomona, which coincidentally is the lowest household income area as well. If you are curious, below 9th grade, here's a map depicting that. Here the dark blue represents the most people. Once again, this is centralized down the center of Pomona. This next map shows the percent of graduate professional degrees, in which we do not see many. We notice about 19% of the darkest blue shows, which coincides with the highest household incomes. Now that we are done discussing demographics, let's move on to health and mortality. Health and mortality is an important statistic to understand. In Pomona, many people are uninsured. 27.8% of Hispanic or Latino are uninsured, and 25.8% of white people are uninsured. There are some major health concerns in Pomona. The information in this chart is from the Service Planning Area 3, or SPA 3, which includes many cities making up the San Gabriel Valley. As we can see from this chart, in 2007, 20.9% of children in grades 5, 7, and 9 are obese, and similarly, 22.2% of adults are obese. Note that obesity is defined as having a BMI over 30. 8.2% of the population has diabetes. Also, 24.2% of adults were diagnosed with hypertension. 31.5% were diagnosed with high cholesterol, and 7.9% of adults were diagnosed with a heart problem. We can also see the percentage of binge drinkers, cigarette smokers, or adults with depression. This next chart shows the top 10 leading causes of death and premature death for LA County. As we see, coronary heart disease, stroke, and lung cancer are the top causes of death. While again, coronary heart disease is the top leading cause of premature death, along with homicide and motor vehicle crashes, quickly followed by suicide and drug overdoses. After looking at LA County, we can see the San Gabriel area, which is a more narrowed area to Pomona. Again, we see a similar causes of death and ranks, but we see a jump of suicide to the top 3 for premature death. These next charts show females versus males. The top causes of death for both are similar, but when we look at the premature death, we see more homicide, suicide, motor vehicle crashes, and HIV deaths among the men. Now let's narrow this down by race and ethnicity. As we compare white to Hispanic, we see white people are more likely to die of suicide and drug overdose, while Hispanics are more likely to die of homicide and motor vehicle crashes. We also see Hispanics are most likely to die of liver cancer, and white people are more likely to die of colorectal cancer and breast cancer. Moving on to our next charts. Let's quickly look over the other races as well. For every race, we notice coronary heart disease. For all ethnicities but white, the next leading cause of death is stroke. The next major cause of death among all ethnicities but Hispanics is lung cancer. Now, as we look at the premature death, we can quickly see Hispanic and Black have homicide as the top causes of death. We also notice that white and Asian have suicide as a top leading cause of death, which is not seen in the other races. Now we will look at the mortality for different age groups. We see many motor vehicle crashes and homicides from ages 1 to 44. As we look at the older age groups, we see coronary heart disease again as number 1, along with stroke and lung cancer not too far behind. Now, as we move into other factors affecting health, we examine this graph, which shows the incidence rate of AIDS among adolescents and adults. We notice there is a higher prevalence in men than women, and an even bigger increase in African males, which is represented by the light blue. Next, we will look over the incidence rate of syphilis by gender. We can see by this line graph, syphilis has increased over the years and is more prevalent in men, represented by the orange line. This next map shows the incidence of chlamydia in blue and diabetes in orange in the San Gabriel service area. The dark blue represents most incidences of chlamydia, and the dark orange represents the highest percent of diabetes. While looking at the graphs, we notice the dark regions are very similar, which may be due to a poor community and a lack of resources such as healthcare or education. When looking strictly at STDs for Pomona, there's an average of 1.37 infections per infected person, meaning people are getting multiple STDs. If you put this into square mileage, that is 3.68 STD infections per mile. This next chart shows the percent of reoccurring STDs as compared with LA County. Most of the percentages are similar to LA County. However, Pomona has a higher incidence of gonorrhea than LA. Pomona has 65.5% of incidences, while LA has 59%. We can see here that many people get gonorrhea and chlamydia 4 or more times. After reviewing mortality and health statistics for Pomona, we have some recommendations for the city. Suggestions for optimal health and death prevention are as follows. Eating healthy. This includes fruits, vegetables, lean protein, and no soda. Another recommendation is to exercise, which both of these things can prevent obesity. As we can recall, 20% of children and adults are obese. According to a health survey done for the San Gabriel service area, 13.5% of adults ate 5 servings of fruits and vegetables a day. 39% of adults ate fast food at least once a week, and 46% of children ate fast food at least once a week. Furthermore, 37% of adults have at least one soda a day, and 39.3% of children drinks at least one soda per day. 39.4% of adults reported being inactive, and only 50% reported meeting the recommended daily activity requirement. On the other hand, 18.9% of children were reported to be inactive, but only 35% met the daily recommended activity. Another recommendation is to keep an eye on your sugar levels, cholesterol levels, weight, blood pressure, to prevent diabetes and coronary heart disease. It is also important to practice safe sex. This includes the use of condoms or diaphragms and also getting tested regularly. STDs are on the rise, and for every 100,000 people, there are 274 new cases of chlamydia per year. As we saw from looking at the mortality rates, motor vehicle crashes, homicide, and suicide were high on the list. Make sure to drive safely, wearing your seatbelt, don't text and drive, and obeying the speed limits. Try not to get on anyone's bad side or be at the wrong place at the wrong time so you do not end up getting killed. And finally, call a suicide prevention line, a therapist, a family, or a friend if feeling suicidal.
According to Pomona's demographics published in Data USA, the median property value in Pomona, California is $344,200 in 2017, which is 1.58 times larger than the national average of $217,600. Between 2016 and 2017, the median property value increased from $310,100 to $344,200, about 11% increase. The homeownership rate in Pomona, California is 52.6%, which is lower than the national average of 63.9%. In the pictures and videos taken from Pomona's neighborhood, some of the properties seem to be worn down. While exploring the neighborhood, we observed houses that are protected by bars over windows. We also noticed a lot of dry grass and unattended vegetations grown in the front yards, along with abandoned furniture. There are many empty lands with different sizes that are mostly covered by rubble and sand. Few trees are visible in few of the lots with no other green surrounding them. Parameters of most empty lands seem to be fenced off to prevent access to public. This map illustrates City of Pomona's boundaries. As you can see, the city starts on the north side from Foothills Boulevard and finishes on the south at Highway 60. Also, you can see Pomona is bounded on the west and east by Highway 57 and Mills Avenue, respectively. Metro is a common hangout place in downtown Pomona. This place is 3 stories building. As you enter the premises, they offer tasty food in the dining area located on the 2nd level. Also located within this level, there is a performance stage that is occasionally used by local artists. The lower level provides a bar and a hangout area with pool tables. and the third level is mostly used as a banquet room for special events. Another hangout location is the Fairplex. Fairplex is home to an abundance of events, trade shows, fairs, etc. When it is not fair season, the halls are utilized for a variety of events. Each event has its own entry fee and many parking spaces. Many people walk in the streets of Pomona to reach their destinations, while others have chosen bicycles for transporting from one location to another. We also found out that using the bus is another common means of transportation by observing men, women, and children waiting at bus stations. Metrolink is also another popular option at Pomona, which provides access to a variety of close and far destinations.
While driving around, we spotted no gyms or spas. However, we drove past several unoccupied parks. As you can see in the pictures, we also spotted pawn shops, doctor clinics, religious centers, and auto shops. There were some families walking with their kids on the streets. However, they were mainly homeless and regular individuals. Many individuals walking on the streets wore regular clothing, but interestingly, we did spot a male walking shirtless. A lot of the homeless people lived on the streets and dragged all their belongings in a shopping cart. The homeless people also had disheveled hair and wore old, raggedy clothes. There was a lot of graffiti on homes and on the wall of stores. For the most part, many of the homes in Pomona are intact. However, there were some we spotted that were old with faded walls and broken windows. Many small streets are also covered with trash and filled with gutter water on the edges of the streets.
As John stated earlier, the ethnic makeup of residents in Pomona is 70.6% Hispanic or Latino. The most predominant indices of ethnicity in the city of Pomona during our windshield survey appear to coincide with this data. This is shown through a majority of stores, advertisements, and public information posted being in Spanish. However, there were also some sparse indicators of other ethnicities, such as Chinese and Korean. The religions of the residents in Pomona varies quite a bit. From what we observed in the community, we saw evidence of heterogeneity of religions, including Christianity, Catholicism, Presbyterian, United Methodist, Baptist, Buddhist, and Islamic. This was made apparent from the varying places of worship, including churches, temples, and centers. The healthcare settings available to the residents of Pomona include hospitals, clinics, and health centers, each having their own specialties of services to offer. The main hospitals in Pomona include Pomona Valley Hospital Medical Center and Casa Colina Hospitals and Centers for Healthcare. Pomona also has several clinics throughout the city, which offer a wide variety of services. Many offer health services for the whole family, treating men, women, and children. Most of the clinics also offer urgent care services, welcome walk-ins, and have bilingual staff to help facilitate the healthcare services provided. Additionally, Pomona has a community health center which not only provides medical services, but dental services, mental health services, and a pharmacy as well. The health center accepts insured as well as uninsured individuals and has programs in place to help completely cover the costs of services provided. Some clinics throughout Pomona reflect evidence of acute and chronic conditions by providing specific care for diseases such as diabetes. In terms of politics, we did not see any political campaign posters during our windshield survey of Pomona, nor did we see any visible evidence of a predominant party affiliation. However, according to statistical analysis of political affiliation based on the 2016 election results, the city of Pomona is predominantly Democratic, with over 70% of its residents voting accordingly. In Pomona, we found that the residents had access to media through several newspapers and magazines, including the Los Angeles Times, Nuestra Gente, and El Aviso. Nuestra Gente, which translates to Our People, is a free weekly classifieds publication founded and dedicated to guide, help, educate, and entertain the Hispanic community. El Aviso is a magazine with information and news on entertainment, sports, lifestyle, cooking, pop culture, health, and technology.
For food in Pomona, we looked at two places. One was a local market called the Happy Market, and the other was the well-known chain Walmart. As we can see from this chart, potatoes and hot dogs cost around the same price at either place. We definitely noticed a price difference in the meat prices, which could be due to the Happy Market only having fresh ground meat available, while at Walmart there were so many options and we chose the pre-packaged meat. There was also a difference in the oranges. Walmart most likely imports the oranges, while the market grows them locally, which could explain this price difference. This next map shows a map of all the fast food places in Pomona. As we can see, there's Carl's Jr., Wendy's, Sonic, Burger King, and Taco Bell, and there's also others that are not pictured. I also noticed Pomona has 6 Jack in the Boxes and at least 3 McDonald's. The next map that we can see is the grocery stores in Pomona. Some of the grocery store chains are Food for Less, El Super, Winco, Walmart Neighborhood Market, Smart and Final, and Cardenas, in which Pomona has a total of 3. They also have many local markets such as Mercado La Conchinilla, Mi Mercadito Market, Jimenez Ranch Market, Pomona Happy Market, and Grand Market. If you notice, there's no Trader Joe's, no Costco's, and also no Whole Foods. The next map here is the restaurants in Pomona. We can see they have lots of taco places. These are Juanita's, Los Jarritos, Mexico Lindo, Tropical Mexico Restaurant, Tijuana Tacos, La Fuente, Tacos Jalisco, which coincides with the type of people who live here. I also noticed many Asian or Thai places such as Chinchilla Chinese Restaurant, Mixed Bowl Cafe, Kwan's Restaurant, China Walk, and China Express.